Good afternoon, everyone. We're just going to check and make sure we can be heard in the Zoom webinar.
Yes, we're hearing you well, Sam. Thank you very much.
Excellent. Then we are ready to begin on time, Chair.
All right. We're still at 39. All right. All right. Welcome back from the lunch break. We'll go ahead and move on to our next item on the agenda, which is our 7.4. Right? Is that? Yes. Okay. 7.4, consideration of resolution 2022-118, adopting final budget for fiscal year 22-23 to increase revenues and appropriations in budget unit 4015 Behavioral Health Services Department. And I see the Behavioral Health Services Department staff and director, Todd, coming up.
I thought your vacancies were better than this.
Yeah, no, I won't. I told them I would do theirs after, yeah.
You can come up.
There wasn't enough chairs.
Oh.
So I told her she could have this one, but she's like, no.
I'll stand right here. I'll be apart.
Well, I know this has been a long day. I've been following this board meeting.
Oh.
Hopefully I don't take anything down with me.
All right. Thank you.
Well, thank you, Mr. Chair and members of the board. I know this has been a long day, and we'll do our best to keep it brief, even though I brought in the troops to make sure that if there are any questions I can't answer, that hopefully they will help me out. But so what is before you is a resolution to increase our substance use disorder services budget in the amount of $10 million. I know that sounds like a lot of money. It is a lot of money, but it's all good. It's all good because what we found in working with our New Life Tribal Clinic over in Ukiah over the last few months, and you've heard me talk about this before, that we've seen an increase in utilization of services, which is a good thing, good problem to have. So we talked about this here before, as your board has already approved the amendment to our existing drug Medi-Cal agreement. It was last month. So this $10 million will cover the deficit fund balance that we've talked about before, and allow us to continue to provide mandated substance use disorder treatment services at the New Life Clinic in Ukiah. And again, we're excited about this opportunity to work with the clinic over in Ukiah, because we are able to serve more people than we ever have. And I have staff here that might want to fill in anything that I've missed, but I'm trying to keep it brief because I know you've had a long day so far. And this is a great opportunity. The funds are there, and we're doing more than we ever have before. So did anyone else want to? They're all shaking your heads.
All right.
Questions?
Are there any questions from the board?
It looks like I'm looking at a twofer. You're up here for 7.4 and 7.5 to actually.
Yeah, this one, if the board approves this resolution, then we can move on to the next item. So yeah, they're both they're both tied together.
Other than the big digits, this is reimbursement funding, right? So.
Correct.
All right, thank you.
Supervisor Sabatier?
Yeah, just a quick question. The 1.8975 million says from that amount over fiscal years 20, did it start off at 2020-21 at that amount, and then it's slowly increased to what is now 22-23 to 10 million? Just to kind of understand where that number came from.
I believe we're into this, it's this fiscal year.
But let me rephrase, because it says this resolution will increase, and it's weird that it mentions 2021 because we're not increasing 2021, we're increasing 22, 23. But it says we'll increase the substance use disorder budget for behavioral health from 1.8975 million over fiscal years 2021, 21, 22, and 22, 23. I know it's your board memo, but I just kind of wanted to clarify because I see the only approval is 10 million for 22, 23.
Do you want to answer? I believe that's because the memo was written before we made, we worked with Kathy and Stephen to adjust the resolution. So that's probably why those are on there. We changed the resolution.
And it's only 22, 23 from what I'm understanding. Okay, just wanted to clarify just in case there was something I was missing.
All right. I'll open it up to the public, see if there's anybody online, because, yeah, there's nobody in the chamber, so we'll go and see, and I will give a couple seconds. No hands, so we'll go ahead and bring it back to the board for further action.
And I'll just make a quick comment. We did already approve the 28 million or 26 million with the state, as you mentioned earlier.
Yes, last month.
I'm getting lost in the big number.
It's all right, it's complicated.
And since this is within the boundaries of what we've already stated with the state, for this one, I'm going to say yes. For the next agreement, I'll have further comments. And if there's no other conversation or questions or comments, I move to approve Resolution 2022-118, adopting final budget for fiscal year 22-23 to increase revenues and appropriations in Budget Unit 4015, Behavioral Health Services Department, to $10 million.
Second.
It's there's a resolution.
It is a resolution.
Resolution has been offered.
I renege all my remarks and say I offer the resolution.
All right, Supervisor Simon?
Yes.
Supervisor Sabatier?
Aye.
Supervisor Green?
Aye.
Supervisor Pyska?
Yes.
And Supervisor Crandall?
Aye. All right. Item 7.5, thank you for that, and resolution is passed. 7.5, consideration of A, request to waive competitive bidding according to Section 38.22, and B, agreement between County of Lake and New Life Health Authority, DBA New Life LLC, for a substance abuse disorder outpatient drug-free services, intensive outpatient treatment services, and narcotic treatment program services for fiscal year 22-23 in the amount of $10 million. And we'll give the floor to Director Metcalf.
Yes, thank you, Mr. Chair, members of the board. So thank you for approving the resolution, because we needed that approval in order to enter into this agreement with New Life Clinic over in Ukiah. Again, as I said, we are mandated by the state to provide these services, and we did go out to bid earlier this year, but since New Life over in Ukiah is the closest provider to Lake County, that's the reason we're asking to waive the formal bidding process to enter in an agreement with New Life. And I think that we may have someone from New Life in this meeting that might want to say more to this, but as I said before, we are seeing a dramatic increase in folks utilizing these services, which we have never seen before, which is a really good thing. And so we are very excited about this, and we are new at this. That's why this has been pretty clumsy, bringing this to the Board of Supervisors, because we are we're the only county right now doing this, utilizing these funds, these tribal funds, to help folks with substance use disorders, and we are very excited to bring this to you, and we're being very brave about it because we are still trying to figure it out. But New Life Clinic is helping us through this, and I don't know if, is she there? Oh, she's there. She might want to say something to this. I asked her to join us, if she can, to speak a little bit more about the services that she oversees, that we are entering into this, hoping to enter into this agreement with. Oh, there she is.
All right. Jennifer,
Hello.
would you like to speak? Go ahead.
Sure. Thank you so much. It's a great honor to be in front of you today. And by way of introduction, I'm working not only with New Life Clinic as a Tribal 638 clinic, but in my former capacity before I was a consultant, I was the director for the state California Department of Healthcare Services. And so I oversaw all 56 county behavioral health plans, as well as all of the rest of the Medi-Cal program. So I just wanted to very quickly help ground the board's understanding of a Tribal 638 clinic. They are distinctly recognized by both federal and state law. They have a very specific designation for purposes of Medicaid. They are owned and operated by tribes through a compact with Indian Health Services. And the onus of both state and managed care plans, of which you are one as a behavioral health plan yourself, the onus is on you to contract with tribal entities, as opposed to the other way around, where healthcare more generally, usually healthcare entities want and attempt to contract with plans, but tribes as distinct sovereign nations with, again, very specific federal and state protections and recognition under law, the onus is on the state and on the counties to contract. New Life, as a 638 clinic, has its rates for reimbursement set by the federal government. So they are not subject to negotiation. They are not based on the costs of a specific clinic, but they are established every year in the Federal Register. Those funds that the clinic and the tribe generate from their services have to be reapplied to the tribe's health and human service programs, right? They're not like other sources of revenue that tribes could generate through other types of business operations. So all of that being said, the New Life Clinic in Ukiah, since it has opened, has served residents of not only Lake County, but also Mendocino County through Partnership Health Plan. And when Lake County started to see a fairly dramatic increase in the number of residents that were attending the clinic, the tribe approached the county and your staff at the behavioral health department and offered to fund the non-federal share of those Medicaid services. So today, the county is using your realignment funds to fund those Medicaid services, right? Medicaid is a matching program, and the tribe has offered to fund that on behalf of the county, and in which the county would then be drawing down the federal funds from the state for those services and returning them back to the tribe. So in a very simple way, that is the contract that is in front of you. Is it's in recognition of the revenues that are generated through this tribal clinic based on the federal encounter rate, but also recognizing that the tribe will be providing the non-federal share of funds for the county.
Thank you, Jennifer.
All right. Are there any questions? Supervisor Green.
Well, I appreciate the creative use of the word simple. I know it's much more than that, and I'm just going to leave it at that. But as far as referring, one, very excited to hear about this program, but I don't know if there's some, to get the drawdown on the federal funds and all that, I don't know if there's how we refer people to the program, what eligibility things we have to meet, what kind of metrics we have to meet and all that, just because, you know, coming from DSS, much different world, but eligibility is a big thing, and tracking patient outcomes, aggregating that good stuff. So I assume that's cooked into the reporting that this master program has, but, and I don't know if it's a question for BH or you, but, and I'm not worried about the reimbursement. I know that's all going to work out, but how do we figure out, how we monitor if we're getting bang for the buck in enrolling this program?
Thank you. April Gambra.
Close to the microphone.
Yes. April Gambra, Deputy Director for Behavioral Health Services, Mental Health and Substance Use Disorder Programs. Nice to meet you, Board Member Green. And so I will start off by saying that we are incorporating a routine plans of monitoring. We do on-site monitoring. We recently visited the facility. We are in constant collaboration with the entity. We receive invoices, payments, updates, reports. We did a presentation not too long ago about retention and how to access services. We've started tracking referral processes, so we know when individuals are going in and when they're coming out. We recently have had 9 discharges with a retention rate of almost 9 months. When individuals come into our facility, or for that matter, when they go directly to the program itself, they are screened for services at the lowest level of care. So it's not automatically that if you have an opiate use disorder, you are intaked into the program. There's a series of screening to determine best fit, medical necessity. So if an individual does assess out as meeting that level of care, they are admitted into the program, and then we continuously, we do case management, we do care coordination, all of those things. We have data that's coming in. We're getting better, thanks to prompting from our community, at developing reports and presentations on contracts. This is one of them that we're probably the most robust in. I'm very confident in our ability to work very closely with them and monitor individuals going in and coming out of those services. Yeah.
Thank you. Quick follow-up question, and it's just probably my confusion and the community's broader confusion too, just how critical BH is in moving this stuff forward, but referrals from other agencies in our community, police, what have you, DSS programs, I'm thinking for some reason of dependency drug court and stuff like that. Mm-hmm. So I know you have existing relationships with any number of agencies in getting referrals, but this is big, so if we can somehow communicate that bigness and get those people. This is all inpatient services for this? No.
No.
This is a mix.
So methadone is outpatient. Particularly, they are a medicated assisted treatment program, so they provide more than just, and they're actually more than a MAP program as well. A Tribal 638 clinic is all-inclusive. It can provide anywhere from therapy to small medical, incidental medical services, and medicated assisted treatment. Referrals going in, we would like to start to advertise more. We've been trying to get a handle on the dollar amount because it is considerably different than the $12 or $15 that state reimburses. These are $640 per service. And so we wanted to increase the referrals. We want to increase access to these programs. But as a county department, we are also responsible for that funding. And so it's been kind of difficult to navigate both. And so our hopes are that with today and the approval of this contract, we no more are concerned about the limitations for funding and our ability to cover those services. We are hopeful that we can move forward as we've ironed out many of the barriers that we originally had faced.
Yeah.
You're welcome.
Supervisor Sabatier?
So you said you did an RFP, but you didn't really provide any description of what happened with the RFP.
Can I also do that? Okay, perfect. No reason to cry, it's okay. Okay. So when we did an RFP for services, we did an RFP for all ASAM levels of care. And I will, if you don't mind.
An ASAM,
So an ASAM is the Addiction...
Association for Society of Addiction.
yes, thank you.
So what that is it is all levels of care from early education to residential treatment, withdrawal management, all of the gamut of services under drug Medi-Cal organized delivery system. We did an RFP for all of those services. As it was previously mentioned, New Life is the only Tribal 638 clinic, and they are the only NTP provider that provides methadone services. So we did not receive any bids or any responses for our ASAM levels of care. But I would also like to say that since 2017, to our contract with New Life, we have continuously reached out to Aegis, to other organizations working with Partnership Healthcare Plan, Department of Healthcare Services, trying to find somebody who could provide methadone services as it is a mandated service, to no avail. We could not get anybody to come to our county to be able to contract to provide services within the 60-mile radius. Individuals were traveling as far as Santa Rosa or sometimes even further. So the trip to New Life is shorter, but although there are still barriers to accessing based on limitations with time and distance, right? But we made a series of efforts, and we did not come up with anything. Our best case was with Aegis, but we couldn't find real estate within the county.
And one of the reasons I was asking is, well, obviously the details matter, and I appreciate you mentioning Santa Rosa, because depending on where you are in the county, Santa Rosa is closer. And so I hope that we continue to try and have access to their facility in Santa Rosa if they're providing the same services in Ukiah, because it takes me as long to get from my house to Lakeport as it does for Middletown to get to Santa Rosa, just because things are closer depending on where you are in the county. So it's not just from Lakeport.
So we do have clients who are still attending MedMark, I believe is who they, it's DAC, Centerpoint DAC. We don't need a contract with them as a drug Medi-Cal state plan contracted county. They can go anywhere and receive those services, and we are financially responsible for them, which was originally what prompted us to contract. The difference is between those programs and or New Life is that New Life is a tribal 638 clinic. So individuals get the right to choose. They don't have to go to New Life. They don't have to go to MedMark or another DAC, another entity. But none of those other entities are tribal 638 clinics. So they don't use the methods that New Life incorporates into their diverse population that they serve. They don't just serve Native American populations or the tribal community. They do open it up to all, right? But the other programs, they do not offer tribal NTP services.
It's just that there was a reason given that it's the closest, and I think it just depends from where you're coming from. Supervisor Green, you mentioned you're not worried about the reimbursement, and I am. I know that we're changing our strategy in comparison to 21-22. Now there's no payment to New Life until we have been reimbursed. And I've had to sit down with CSAC because I'm very concerned about the growing amount of dollars that are going through the department. And I want to make sure that we do have the ability to reimburse and that we don't get stuck with the bill. And one of they didn't say it's not going to work. They didn't say it will work. They said, never heard of this before.
Correct.
Where, how do you get reimbursed by the state if you can't prove that you paid for it? And so I'm concerned about reimbursements in that sense, and I know I checked in with Director Metcalf. We have $1 million so far that has accumulated just through September. This doesn't count October and November, and I'm just going to be brief and blunt. I'm concerned about seeing a contract after we've already incurred $1 million so far without a contract. That's a separate thing. And so if that's for 3 months, then I expect that it'll be possibly close to the $4 million range by the time that we're done. We're asking for $10 million. We've already had to borrow money last year because of the fact that we were paying prior to getting reimbursed. We did receive the majority of the reimbursements. I believe there's still some negotiations with Medicare for $300,000, $400,000 or something. So it's not perfectly ironed out. And you're asking for $10 million when right now 1/4 is $1 million. I'm very comfortable with doubling last year's and saying 3.2, come back if you need to amend it and let us know what the status is of reimbursement. Because if we're at 3.2 and we still haven't gotten 0 reimbursements and we're still trying to figure out if this is going to work exactly as planned, I'd rather have that conversation than say go for it for $10 million. Because we can always amend, we could always change. But I have concern that such a large number, if we find ourselves where, I mean, New Life has to pay their bills. And if they start requesting money that we don't have $10 million to give unless the reimbursements are coming through. So I want to move something forward, and I'd like to offer 3.2 since it's anticipated possibly about 4 million for the full year. Yes, it does add another hurdle where you have to come for an amendment at a later time, but that's where I feel comfortable at this moment in time.
Jennifer, I see your hand up, so I'd like to give you the floor.
Sure, thank you so much. So I think one of the things that may help in your deliberations on this particular motion is that the California Medicaid budget relies on the provision of local county funds to pay for part of the services, right? We use your county behavioral health realignment funds to fund the share of your drug Medi-Cal and your specialty mental health services care. The tribe, in the process that has been presented to the Department of Healthcare Services from both the county as well as the tribal clinic, was a very similar process to how we do it today for both the county behavioral health system overall, as well as there are 19 designated public hospitals in the state of California that use what's known as intergovernmental transfers for how that funding is provided. And so what has been provided to the department for your county in particular was essentially a proposed cash fund process by which patients are seen in the clinic. The clinic generates both an invoice to the county for those services that map to the amount of funding that the tribe will provide the county, so that the county can then attest to the state that a local government cost has been incurred, because tribes are recognized as governmental entities and their funds are as usable and as fungible as the county funds. And so there is a process that is pending at the department such that that would allow for this contract to move forward. And so it really, it is a legitimate way in which Medicaid, not only in California, but nationally, is how Medicaid programs fund their services, is using local funds or tribal funds as the non-federal share. And so I think that's also been some of the ways in which we have worked with CSAC and CBHDA and the department in how to effectuate this particular contract change.
And just to finish off real quick, you said the word pending, and I know that Director Metcalf also said we hope that it will work out this way. And how many other counties are doing this? We're still the only one, which is why I'd love to say yes to make sure we get at least past the 6-month mark, so that we can, again, check in and see how this is going, because this is a large number of money where if it doesn't go well and the pending doesn't end up going well, it's not an issue of the contract with New Life, it's an issue of the reimbursement coming from. I mean, we just got canceled by Governor Newsom, and luckily now we're back on. That could potentially happen for things. We know there's a $25 billion deficit. I'll stop there, but I'm looking for my comfort zone for this so that you can move forward.
I'd like to respond. So, not to sound crass, but it essentially doesn't matter how much the contract is, because we're still on the hook for any services that are encumbered from New Life. And so whether or not they build us $1 or 10 million or 100 million, we would still have to pay for that because it is a mandated service. Now, the agreement that we have entitles us to reimbursement at that full federal OMB rate. Without that agreement in place, and I understand the agreement isn't necessarily what's in question, but the amount, we would have no recourse or entitlement to that full reimbursement rate. We would be stuck with a reimbursement of about $15 for a service that is costing us over $600. And so, regardless, again, of whether or not what the dollar amount is, I think it would be a very dark reality if we were in a situation where they were halting Medicaid payments due to our budgetary situation, and I'm not sure that situation has a precedent, and I'm not sure that I feel comfortable, I'm not sure that it that would be a wise way to inform our provision of services. It is risk averse, and I understand that that's definitely a concern from a federal budget standpoint. However, at this point, I don't know that those federal Medicaid dollars are in question when we're looking at reimbursement from, for these services. Does that make any sense?
And I'd also like to just add that, correct me if I'm wrong, Chrissy, please, but regardless, we are still entitled, whether or not it works, whether or not this proposed mechanism of payment and reimbursement is approved at the federal, we are still allowed a certain percentage of payment back on that dollar. So we're not even talking about the full 10 million that we are at risk of not getting payment for because we haven't been guaranteed that payment. We're talking about 10% on a 90%, or we're talking about, at worst case, 50-50 on that dollar. So the risk is a lot less than it appears at surface, right? So we're only asking for the consideration on the 10% and the 50%. We are guaranteed those other payments as we've received how much in? We've received 80% of it, 70% of it, at least. Everything that we've built up, we've already gotten back. We're talking $300,000. And I understand it's a lot. It is a lot of money, but it is small compared to the 10 million that is being presented. So,
Supervisor Pyska.
My question was along the lines of the process being pending as well. And I was wondering if Jennifer could speak to that.
Sure. So today in California, it is a really routine process that the department works with, like I said, with counties and public hospitals for these either they're called CPEs, which are certified public expenditures, or IGTs, which are intergovernmental transfers. And especially for like the public hospitals, there are IGTs that are done in the hundreds of millions of dollars. So it is a routine process. I think what we wanted to do was that tribes today in California do not fund any of their tribal services. So Pinoleville and New Life Clinic is the first tribe to offer to fund the non-federal share. And I think that is the process that we put in front of the department for consideration was, reminding them that they have full legal authority under federal law to do this. It has to be voluntary, right? You cannot require the tribe to fund these services. So they did so voluntarily. They are doing it under federal law allowance. And I think the department has just been, unfortunately, oversubscribed to a lot of other work. And so again, Director Metcalf and the tribal chair have sent a letter to the department saying we would really like your swift review of this process so that we can move forward. And I know that the supervisor was in contact with CSAC, which was also helpful in putting some pressure on the state to act. But it's not an unusual process by any stretch of the imagination. It is done and has been done for years and years at the state level in terms of using other funds to draw down federal dollars.
All right, Supervisor Green.
Just one last thing, and again, I plead ignorance. I look forward to our orientation someday. But again, over in DSS land. So I don't know if you've estimated, just ballpark, the amount of referrals you might be able to get over there and all that, but to Supervisor Sabatier's concerns about timely reimbursement at least, do we have enough ducks in a row in your current eligibility screening and stuff to get people in the pipeline and then do whatever paperwork you need to recoup? You're feeling good about that? I see people shaking heads.
Yes, oh, absolutely.
I see, okay, thank you.
All right, so I'll open it up to the public briefly to see if there's anyone that wants to comment on this online. All right, not seeing any hands up, I'll bring it back to the board for either further discussion or action.
No more discussion.
One last question. Payment. Contractors' invoices shall be submitted in arrears no more than 180 days after the date of service, or such other time that is mutually agreed upon in writing shall be itemized, and county shall make payment within 30 days. Just kind of checking in typical language in our agreements, but not typical agreement that we have, yet it's not, I feel, in writing.
No, the 100, we actually extended it to the 120 days so that they could, because they bill Medicare, and then whatever Medicare doesn't pay, they bill to us. So we had to give them extra time to bill the Medicare and then to bill us, and for us to process that payment. But then the payment reimbursed, it should say within 30 days of being reimbursed by DHCS.
I would love to add that to make sure that that is.
Yes.
So noted.
Yes, yeah.
Nice catch.
All right.
There's nothing further, Honorable Chair. I move that we waive competitive bidding according to Section 38.2, Paren 2, and approve the agreement between the County of Lake and New Life Health Authority, DBA New Life LLC, for substance use disorder outpatient drug-free services, intensive outpatient treatment services, and narcotic treatment program services for fiscal year 2022-23 in the amount of $10 million.
I think it's just motion to waive first, and then we'll do the B after, so, right?
Yeah, and it's as amended.
I didn't see the B in there, or I would have said it.
Yeah, that's normally how you do it, but you could do it all at once, except if for any reason you have to reopen one, you have to reopen both.
We'll do the.
So what's the B, the agreement?
Yeah, the agreement.
Okay, you want me to do the A?
Yes.
All right, how about I move we waive competitive bidding according to Section 38.2, parentheses 2.
Second.
I have a motion and a second. All in favor?
Aye.
Opposed? Motion carries.
I also move we approve the agreement between the County of Lake and New Life Health Authority, DBA New Life LLC, for substance use disorder outpatient drug-free services, intensive outpatient treatment services, and narcotic treatment program services for fiscal year 2022-23 in the amount of $10 million.
As amended.
As amended? Was there an amendment?
Aren't you making
Yeah.
an amendment?
Yeah,
There's amendment on the language.
yeah.
You can specify Exhibit B, potentially. That is the amendment, sorry.
Just as amended is fine.
As amended.
Or what was the amendment again?
The amendment was so that we don't have to be forced to pay if we have not been reimbursed. So 30 days after receiving reimbursement is, I believe, the language that should be added to
Yeah,
Exhibit B.
yes.
As amended.
Second.
I have a motion and a second. All in favor?
Aye.
Aye.
Opposed?
Nay.
Motion carries 4-1. All right, thank you for that, and thank you for the presentation. All right.
Thank you.
Thank you, Jennifer.
Thank you very much.
All right. We'll now go back to 7.2, consideration of agreement with Lake County PEG for professional videography services, specifically for coverage of municipal advisory councils. All right, Supervisor Sabatier, you brought this forward, so I'm before you.
Try to share the screen. All right, so before you is an agreement between the County of Lake and Lake County PEG TV for professional services of videography. And so just real quick, PEG station, PEG stands for Public Education Government. Started out here in Lake County with a connection with Yuba Community College, where they were able to help create the PEG station so that you can have classes coming through from Yuba College, and that it's expanded into what PEG is, which is a federal program. We work with MediaCom. We get a portion of the fees that people pay for getting cable. We also have a 1% pass-through that provides us with capital improvements and such. What we are aiming for is we're looking to add more local content, we're looking to expand membership and viewership, and we're looking to setting a new standard in our local broadcasting. We have been expanding our membership and our viewership, mostly viewership. We have a new website that is just purchased last week that we are intending to start and advertise very soon. And all of the above recordings from the city of Clear Lake to Lake County Board of Supervisors meetings, including other things like Planning Commission, are all there. Lakeport is about to go live by the end of the year so that they can go ahead and also stream their content directly onto PEG TV Channel 8, which actually will be awesome for us because that means we have to limit our meetings to 6 p.m. and not any later, or else we're going to be broadcasting on top of Lakeport's meetings. It's a good thing. What the agreement offers is to provide videography services for specifically, I didn't want to make it about too many different things, start small, somewhat of a pilot program with the municipal advisory councils. We have been approached by 5 out of the 6. I know Cobb Area Council has spoken to PEG. The entire North Shore Town Halls has spoken to PEG. And just recently, we had Middletown Area Town Hall also reach out to PEG for similar services. Why offer videography services? We want to make sure we're keeping the public informed and easy access to our meetings. It helps create a historical archive of all the meetings and also creates what we're aiming for, which is more local content for PEG to share with the community. So the process in which that a videographer can be requested is the MAC would request a videographer by contacting Lake County Administration. Now that could be the MAC, that could be the Board of Supervisor, either one, but they have to communicate with Lake County Administration as they are the ones that basically say yes or no to utilizing this agreement for the services. The best practice would be to request for the calendar year, just as that would make sure that we can have a videographer available for those dates rather than asking within a small time period available. Admin would process the request, and if approved, they would forward that request to PEG, and we would make sure that there's a videographer available. PEG videographer would record the meeting, and within 7 days, the MAC and admin would receive the final edited product, and PEG would upload the final edited product to our website and affiliated sites. We have YouTube and others. And we would also potentially, if allowable in our programming, play back on Channel 8 as well. Every month, an invoice from PEG would be submitted to the auditor controller for payment. It would cover the setup time, it would cover the meeting time, it would cover the editing time. The cost to the county would be at $40 per hour for videography services. And again, this includes what I just stated. And the, can't read that, I gotta look up. Current agreement is for a maximum not to exceed $10,000 for fiscal year 22-23 through June 30th, 2022. Oops, I'm so sorry, June 30th, 2023, typo. There's the once we look at that, there's already a possibility that we would be coming back if everything's working for next year to look at 20,000. Since we're almost 6 months into it, that's why we're asking for 10,000 to make sure we can cover it. There is the potential for training that's part of the agreement so that we can train somebody from the town hall municipal advisory group so that they can go ahead and lease our equipment and use the equipment themselves so that you don't have to go through our videographers, but they do need to be trained because we want to make sure that the final product is of equal quality so that whenever somebody is watching these, they can predict what it is that they were, what the quality of the product will be. And again, the equipment lease per use is $50. Streaming capabilities are definitely possible, but first and foremost, we would need to ensure that the internet capabilities of the facility that the meeting is taking part in has that standard so that we can make sure that we have a quality streaming capability. We're asking for 5 Mbps upload and 15 Mbps download, and you can find that out from your local provider and make sure that we have that. The reason, again, is to ensure the quality of the product. Zoom is always a possibility, but streaming it in any other ways, we need to make sure we have a higher speed. Our next steps as PEG, if this is approved, is we would go ahead and purchase the equipment. I was just told recently that the equipment should be available, but we have been dealing with supply chain issues. We're still waiting on one of our cameras that we ordered a while ago. So just because there's an approval today, if there is approval today, doesn't mean that next month we will be ready to go. We need to make sure we have all the equipment. We have equipment already that can be utilized, but we want to make sure that we don't patch together equipment. We want to make sure this is the complete package so that we can provide, again, the quality product that we would be providing. So as soon as it's received, we would let all the MACs know, and they can go ahead and start requesting videography services through the Lake County Administration. And I believe that is my presentation.
All right. Supervisor Pyska.
Yeah, I think this is good. I think it'll help with the consistency across the municipal advisory councils too, having a standardized platform. I know in the Cauberry Council, we've had a great team doing it, but it's been all volunteers, and so that's always problematic. And so if we want to build sustainability into expanding the participation for these meetings, I think it's helpful. I don't know what the viewership of PEG is. I don't really know if anybody in my area watches it. I haven't had cable in a long, long time. What's most important, I think, to my advisory council is that it's on Zoom and streamed on Facebook. That's how they get the most participation. But if it was recorded and then on a YouTube channel, I think that would be helpful too. What is the time for the post-production editing? Because if it's 40 hours or $40 an hour, so our meetings never go longer than 2 hours plus $50. You know, how much more is going to be built into each meeting? Because I think that's a little bit of an unknown.
So the idea of editing is mainly to put the front, what is the Municipal Advisory Committee, and just kind of intro and credit or something of the kind. We're not sitting there to make it perfect.
Okay.
It's mostly just to make sure that it's recognizable where you are, what's being said, who's speaking, making sure the quality is there. But we were looking at, I believe, about $175 per meeting or $200 per meeting. If you would like to come to the microphone, I know that our videographer here, Sam Houston, has been a part of this process and this conversation. But I believe it was anywhere between $175 to $250 per meeting. Again, the editing is not meant to be
Yeah.
commercial quality, video, movie quality stuff.
Okay, so Sam Houston, yeah, I brought this subject up after.
During the budgets, right? Talked
Right.
about it, right?
I'm sorry?
During the budgets, we talked about it, yes.
Right, you're right. I brought this up because so anyway, first off, to address your question, I factored in that we're going to have templates. Each meeting will have its own little template that'll have just a beginning slide, like what we do here.
Right.
It's basically the same thing. The editing is just to take out because I want people to start the meeting early so that we make sure we get the entire content. So what they basically do is cut that off, and then if there's any breaks, they cut those out, because that way the public, as we've learned here, they know they can rely on the data being accurate. And then we put the end on, and then we format it to fit. There's two formats. There's one and it will be on YouTube. It'll be on, it'll be on the County of Lake YouTube and Facebook page. It'll also be on PEG TV, YouTube and Facebook page. So there's 4 different venues that it will be distributed to. So that was that. The editing is basically the rendering time that it will end up taking, which I average in a 2-hour meeting. You're probably looking at about 45 minutes rendering time to edit that, or to render it out to what the final product, and then to be able to distribute it into 2 different formats that are needed.
Okay. And then what about conflicts? Because I know we have municipal advisories meetings at the same time.
So the plan is that there is going to be a conflict in the beginning. So we'll have to work that out, is one has it one month, one has it the other month. My vision for this is once we have this system in place and working, we'll probably look at getting 2 other systems. So that, because I can see this happening, I can see this expanding to not only the town hall meetings, I also see this going to the schools. Because I've heard like schools that can't afford sporting events, but they want to record them, or I've even been approached by school superintendents, is this possible that they could do that as well? Well, we can't do it with this one system, but we could do it with 2 or 3. But we first have to walk here, or just have a beta test, and then we can take it further.
Okay. The only other thing I saw was the advertising for vacant positions, and I don't really think that's necessary, because anybody that would be eligible to pick up a seat on a town hall has to participate and be in attendance, so it kind of makes it a moot point, I think, if you're trying to reach people that aren't already participating.
Okay.
It was mostly as an offer for any PSAs, but I guess I made it very specific to just that. And I will say we do have 2 videographers that are ready to go, and we hope to get more videographers as well, because sometimes some videographers are going to be on vacation. We still want the service to be available. So Sam's right on the fact that it would just be one mobile unit that we can carry around, and obviously there are conflicts, as you just stated, and we hope to overcome some of those in the future.
All right, Supervisor Green.
Yeah, I appreciate you bringing this forward. There are other tools in the toolbox, including for those that are currently tasked with Zooming these meetings. I guess if we have the Pro account, we can do downloads of those recordings, and those could be posted on our county website. So nothing in this appears to limit our ability to get video up of the max 2 peg that I'm seeing. So that's good. And yeah, I applaud this. This is kind of novel. I haven't had the ability to meet with my one MAC yet, Scotts Valley. I'm going to meet with them for the first time next Monday. And one of my questions as we approach the end of the COVID emergency, and my general concerns about how we communicate, love a Zoom if somebody's 3 counties away, but if you're in a municipal advisory council mode, that tends to be kind of close and personal and pretty accessible. You know, the people that live in my MAC all live in Scotts Valley, so, for transparency purposes, I'm not opposed to getting it recorded, but if I end up talking with them and we end up moving away from hybrid meetings and going to in-person meetings, I don't know, it's just kind of a question of bang for the buck. I certainly support transparency. On the other hand, committee meetings, council meetings by their nature are kind of smaller in nature, and the issues they cover are smaller in nature. And if they grow into bigger issues, they tend to come to the full board or the planning commission or whatever for a fuller hearing. So definitely going to support this, because I think as a pilot project, at least, it's absolutely something we should do. But I just want to signal personally that other than the transparency thing, I do have a bang for the buck kind of issue. I'm definitely going to be stressing my personal opinion that in-person communication, even as we get into the last couple bumps of COVID and whatever RSV comes during the winter, I really value that. And I think one thing we've lost in this constant posting of streams and what have you on YouTube and Facebook is some dilution of messaging, because if we get into a live stream situation, there's some expectation that those live streamers who are watching can interact with us and give their input. And that may not always be the case, just as it isn't with the case with our Facebook live stream right now. I mean, they're interacting with us, but we're not actually interacting with them. So definitely another tool in the toolbox. I like the idea a lot. I'm just not entirely sure that I'm going to be jumping my MAC in that direction immediately.
I'm just going to respond. You have people that don't live here. You have people that have second homes, other properties. They want to be involved in any way they can, and if we do get to a point where they're only watching the broadcast, then that's really important. You have to understand that a lot of people don't live here. The other part is it is easy to broadcast on Zoom, but if you don't have all the microphones set up, then the recording is absolutely worthless. So only the person who's sitting in front of the laptop. So it's more complicated when you start looking at hybrids and recordings, and it's bigger than a lot of volunteers should be responsible for.
Also, I'll just add, is having a lot of experience with this in my district. A lot of times there are conflicts with specific directors being at meetings. Certain MACs would like to require a specific director to be there every meeting. And at times there's yours. At one time, math and Lath was at the same time. And so sometimes a director would be speaking before math, but then be like, well, I don't speak till 7 here, so I can come in at 6. So that helps in that aspect for Zoom. The other thing is we also, in a couple of them, they have, like if there's a business or something working with us, like we have Cal Water, and they can't make it every meeting, sometimes it helps that we have the Zoom capability because they can actually call in as well. And there's other situations that help. But of course, if that Zoom opportunity comes to an end some way, shape, or form, especially when it comes to the emergency, like you were saying. I do think it's still very imperative that they stream the meetings, or not stream, I'm sorry, record and put them on YouTube. And the reason I say that is because we do conduct minutes, of course, but at the same time, a lot of the folks love watching the video afterwards, so they can get it. If they're not at the meeting, they can actually get the meeting content and look at it from there. The other thing is that I think when you were mentioning, there was a mention about the editing and whatnot. I mean, I've been doing it, and as long as like the Zoom's finished, it takes a while to download itself, and usually I'll put it in a Dropbox for Sam or somebody to put it on one of the social media accounts. But if I can get it done, I'll upload it right away to Facebook, and it's just the whole meeting. It just goes right in. And so the editing will be a good attribute to it, because you'll have like math, and then it'll say whatever else. And there's times when the internet goes out because of what's stated in yours. I know at Earth there's always a situation at in Lucerne it happens. In Upper Lake a couple times it's happened. And so if they record it just from a recording stance rather than just doing the Zoom, that puts us in a good position to at least have the meeting posted on YouTube or the website. And I think a good thing to do is when we post it on the website, like Sam was mentioning, like on our website, that's where the announcements can come. I know there was one recently from the admin office last week. Then you can just do that rather than doing it on the TV or whatever. You can put it on that. I was just thinking of that when they mentioned it. So yeah. Go ahead.
And I'll just add, one of the things that I do a lot in preparation for our meetings is going through the archive videos. What did we say? What was the discussion? Because as you stated, Chair, the meeting minutes only say so much. To understand the actual context of how we got to a decision is a whole different thing that you can't always just type up. That's difficult to expect. What I love, though, is the coincidence that we also happen to have a brand new website. And if you go to our agenda center, almost every single town hall is on there with agendas, and there's a space for a video icon. So again, it's very easy to go through all the archives of all of the town halls and be able to do that. And each town hall is going to have to work to make sure to keep all that up to date. But I think we have a great start and a good template for us to begin this project with.
Yeah, I think it's going to be easier for the town halls to keep their, everything organized. If this is what they choose, again, they have to make this choice. We don't tell them anything. This is all their choice. But things turn big at these meetings, real big, and they may not ever come here, but they're big and they're important for that community. And however these town halls choose to utilize or not utilize, it is a choice for them. And I think ultimately it'll make it easier and better for the community, but it's up to them.
The sound is usually the biggest problem. And the reason why is, like, you're there in the meeting and everybody could hear, like there's a guy in the back that says something and everybody can hear him, but the people that are on Zoom can't hear. And then if it is recorded, you would need some better sounding systems to happen as well. And so I know that's frustrating for certain folks as well. I know it's been an ongoing issue, and it's also really, for us, I know we have a real structured area, but with the MAX, you're talking about volunteers, and at the same time, they're dealing with some folks that aren't going to get up or do anything, and they're not going to listen regardless. There's one guy that said, "I'd like to see you try to make me leave this meeting," and these folks are volunteers. They're doing a lot of the work, and that's one of the things I was concerned about with the training. I think sometimes with the folks in the town hall, on the committees, or on the, town councils, I think it gets into a slippery slope sometime when they have to conduct this work, because there's some people that want to go above and beyond. But I've also dealt with individuals that really want to help so they can control the dynamic of the meeting, not only the meeting, but what's been projected out, or, whatever the case may be. And so I always worry about that at certain times, but at the same time, this is a really good thing for me, and I'd like to see this go forward, and I'm willing to work in any way to make it be equitable and work out in general, because I know that my town halls all want it. They're all happy about it. Yeah. Go ahead, Supervisor Spotted.
And just last comment, I believe it was in the memo that I submitted, but in speaking with administration, that coming out of the admin special projects budget is where $10,000 can be found. So just wanted to make sure that the public was aware as well as everyone else.
Supervisor Simon?
Yeah, obviously, my number one thing is making sure that you have someone there that can work it all the time, technical support, because I'm always very clear that isn't me. So making sure Peg is going to do that. Ultimately, we always, we're having these conversations. We had this conversation at the last math. I like the list of equipment, because we do need a new projector down at the community center where we have our meetings. So some of the stuff all aligns. But I did have a question just on budgeting issues, on it coming from the admin special projects, because don't we get money from MediaCom to do this? We get money from MediaCom, right? So where is that money going? Wouldn't this be part of it? So that's just my question. If they're paying for it to be a public education, and we have Middletown municipal advisory committees, isn't that money already coming in to pay for this?
And I'll go ahead and start, and I'll let Sam finish.
Simple answer.
The money is there for the infrastructure of PEG to be able to provide content to the public, but videographers doing the work to create the content in order to bring it and put it on PEG is a different situation.
So is the hardware covered then?
Yeah,
Yes, the hardware we're paying.
right, so that's how it works. It's illegal to transfer that money into an operational budget.
Okay.
So what PEG can do is they get the funding, and this is all PEGs. This is not just this one, this is all of them, because I've been involved with about 6 different PEGs. So you can't allocate funds for a videographer. That's PEG's job, is how do they get that. But PEG, on the other hand, can go out, if they have the money, they could buy a building, they can buy equipment, but the other challenge to that is, if you buy this stuff, then how do you
Staff it.
make it work? Because if you have no personnel, do you see where I'm going with that?
So we're going with it, but that doesn't make any sense.
Yeah, well, that's MediaCom, and it's not just MediaCom, it's broadcast industry. That's how they do it, whether it be Comcast and Marin, or trying to think of it. That's how they get around it.
All right.
And if any MAC chooses to do their own recordings, it's absolutely free to submit to PEG and for us to go ahead and air it and put it on there. We are the infrastructure so others can provide content to be able to display on there. We're offering a service where we can create the content for you, but we can't pay for a videographer ourselves because we don't have our operational budget barely covers our station manager, our insurance, and everything else that we have to afford to make PEG actually run. And our rest of the 1% pass-through is only held for capital improvements such as equipment and things of the kind as well.
And then it's also based on if your viewership goes down, if MediaCom's viewership goes down, which it has been going down,
We get less.
you get a whole lot less money. So what this does for PEG is it allows to increase viewership, because if more people are watching, maybe they will be willing to donate more, which will then take PEG to be able to charge, I think they're charging $25 for membership. Well, that $25 can go back into their operational budget, which means that then they can do more production services. So eventually, like, what I'm willing to do is I will go out and train these people that want to use the equipment. And I'll make sure that they can go out there and do the job. I don't want to do their job. I just want to get them trained to do it. And then have them, I know that in this case, Supervisor or Chair Crandall has someone who wants to learn how to do this stuff, and so I will go out and train him. There's not going to be a cost involved in that. I'll just go out and do it. So and then eventually, hopefully, we'll see a whole lot of memberships. So it's just setting it up so that PEG can create more of an operational budget as well.
All right, just had to comment on that one, and since it is education, I agree with having the conversation with the schools, because the videography class, we should be able to do that way too. So anyway, all right, I just had that question on those, but I do support it. It's been talked about. We still have Zoom, that is used, but we do have connectivity issues sometimes, even in Middletown. So that's something we have to build on. Maybe we could talk to MediaCom about having better.
And that,
I believe CAO Parker's working on that.
right. So that is an issue, and we cannot provide that right now. I have tried to broadcast in every place in Lake County. There's only a couple places, so we cannot provide that. What we can do, though, is we can record it and then turn it around, get it out there so that in a timely manner that anyone who wants to view the information has it readily available to them.
And I do agree. I just want to make one comment on something that Supervisor Green said is, Zoom and everything is great, but for your municipal advisory committees, it's for a district. And what we get with Zoom a lot of times is people from all over the county calling in on a municipal advisory committee that is for a specific area. And that's really jumped up since Zoom. So it's a challenge when it's for a district. And, I appreciate people from North Shore and weighing in, but it's like, well, this is that advisory committee's district. And I understand vacant land, second homes and stuff like that, but we get a lot of that.
Ms. Grant?
I'm sorry to even say this, but just to be clear, if you would allow, this isn't really MediaCom's decision. This is a DIFCA matter. This is the Digital Infrastructure and Video Competition Act of 2006. And that's what limits the use of PEG fees. Okay. And it's generally, historically been treated as a limitation only for capital costs. But the FCC is a little bit inconsistent with that. So I can't say it's a hard and fast rule any longer.
And we'll be reviewing that. That is one of the things that we will be reviewing in the upcoming December meeting, is what are our new limitations based on what we understand.
Okay.
And I think too, I know that Sam had brought up someone that I was looking into working on this. I actually wanted, either if this wasn't something that was going to come before us, I was looking at trying to do this just specifically, because I know that Supervisor Simon in the last discussion said, well, maybe within the districts you could use your own discretionary funds to do something of the sort. And so that was my backup. And so I was talking to a gentleman I know that would be really good at this, very objective, would do all three in my district. And so that was an ideal person. I would actually, encourage him to apply with PEG to be a part of the whole group in general. But if there's a situation where that can't take place, I just want to make sure if there is a possibility for me to negotiate on my own end. If it's looking like they're going to train people to do this, I would much rather have one person that's not a town council member or someone designated from them, rather me, to do this, because ultimately, it's always pointed out when there's Public Request Acts or concerns about my max, that ultimately, if something's not done when it comes to minutes, posting, anything like that, they always refer back to, well, Supervisor Crandall is in charge of his districts. So if that's going to be the case, I would like to be the person that decides who is going to do that, rather than allow the town council to do it, if that makes sense. So, yeah.
And in keeping with that, and keeping with Supervisor Simon, not to overthink this, but it reminds me of KPFZ, where allegedly I'm still a programmer and have a show due Friday and Saturday. I better think about what I'm going to do with it. But KPFZ puts the infrastructure in place, the platform, and then the content creators come in and do their programming. And I've done a mix of live, in-studio stuff, and I've done pre-recorded stuff, using my own equipment, using my own editing time, and what have you. I'm not familiar enough with the MAX yet and how they're funded. So this initial funding request under admin makes perfect sense. Admin carries a little bit of the load for the MAX anyway in terms of posting agendas and stuff like that. But I think longer term, if this comes back again and it succeeds, I think there will be a budgetary question next request or two requests down the line that probably we do need to find a budget line that is specific to supporting our MAX, not just in terms of videographers, but maybe we need to cover some of the staff time that admin is incurring in supporting them. And if it's not broken out separately now, no big surprise right there. But I guess that's where I would take a look at going for future budgeting is the MAX. If they are going to be independent, they're content creators. If they don't have a budget of their own just yet, maybe this will be kind of a goose to move down that path. So totally support this. But again, I'm kind of thinking in the content creator side.
All right, so what I'll do is I'll open it up to the public. I'm not seeing anyone in the chamber, so I'll open it up to Zoom. Betsy Kahn, if you can unmute, and we'll start your 3 minutes.
Thank you so much, Mr. Chair and members of the board, and Sam. I do value the ability to participate in many meetings conducted by many agencies and organizations in this county, including the municipal advisory councils. For one thing, since the advent of the COVID restrictions, I have been almost entirely homebound, and it has enabled me to participate in many more functions than I used to be able to do, because I had to drive to them and take that time and wear and tear on my life and my vehicles to just get to a meeting where I could learn one or two important things. But I do want to mention that the municipal advisory councils, even though they might seem as though they're sort of insular and focused only on the business of their particular jurisdictional boundaries, which are still not extremely well defined, a lot of the issues that are dealt with impact all of us. Look what the Cobb Area Council did long ago with looking at the environment, looking at the tree mortality, getting support for preventive services, holding all those conventions and educational practices up there that have benefited every part of this county. Likewise, certain things are done in the Middletown area town hall, where they've developed their own area plan in 2010 that is the leader, it's the standard for developing area plans. And it was the Municipal Advisory Council, basically, that got that done. So I think it would be helpful to understand how much we interact and how much importance there is in engaging the public in as much of this work as possible. I did want to mention, Anita Grant described the the actual agreements and CPUC authority over the broadcast, but that's an extremely interesting set of rules, and the franchise agreements that the county manages do not provide for the support of the actual production. As Supervisor Green was talking about, content production is something else. you know, when you talk about people wanting to go above and beyond, I'm not sure what you're referring to, but I do think it's crucial that this ability, the Zoom, YouTube, and Facebook broadcasting capacity has afforded so many more people the ability to join you on this meeting, for example, and to share things that are important to us, even if we cannot get to the courthouse. I understand Mr. Sabatier and Mr. Green both think it's important to have, be able to do face-to-face discussions, but that isn't always possible. As Supervisor Pyska said, there are a lot of people who have investments in this county that do not live here, and people who cannot be here at the same time. Finally, I just want to mention the reduction of greenhouse gas emissions, which I believe is at the root of some of the governor's most important policies. The COVID itself resulted in the clearing of the air over the Himalayas, if you recall, back in 2020. And I think it's very valuable for us to not have to use our vehicles if we don't have to. Thank you so much for letting me speak.
Thank you. All right, is there anyone else on the Zoom that would like to discuss this item? And if not, I'll close public input, bring it back to the board for action.
Mr. Chair, if there's no further conversation or comments, I move to approve the agreement with Lake County PEG and the County of Lake for professional videography services, specifically for the coverage of municipal advisory councils.
Second.
I have a motion and a second. All in favor?
Aye.
Aye. Opposed? Motion carries. Thank you very much. Thank you for bringing this forward. Excited to see how this moves forward. All right. We are on our 7.6 addendum item, consideration of recognition of Department of Public Works Director Scott DeLeon for 2022 California County Engineer of the Year. And so I'll give this over to CAO Parker.
Thank you, Chair. I wanted this board have an opportunity to acknowledge Public Works Director Scott DeLeon in his receipt of the 2022 County Engineer of the Year Award he received last week. And if I didn't push this, I don't think we would know about it. I received an email from a person attending CSAC, and thought they would be important for this board to actually see the award and maybe take a photo with Scott.
Yes, you would not have heard about this. I'm sure you of that.
Congratulations.
Thank you. It was a heck of a shock. See, I'm the chair of the committee that selects this award, and I went down to our SEAC fall conference fully expecting to give it away to somebody else, and they kind of snookered me and presented it to me. So it was it was a real shock, but pretty proud of it. SEAC's a wonderful organization. You all have participated in CSAC, and that's kind of a sister, cousin of CSAC. It's all public works directors, and I've been involved with the organization for basically as long as I've been here as the public works director. Sat on several committees. As I mentioned, I'm the chair of the scholarship committee, and I was a regional director for many years, a Northern California regional director. And SEAC's just been a great way of learning and getting around other folks. And I'm sure you all have similar experiences when you get around your peers. And even though we're a small rural county, a lot of our problems are very similar to those in urban areas. They may have a few more resources to deal with things, but from my perspective, a pothole in Lake County is the same as a pothole in Marin County, and so anyway, it's been a great opportunity to be with that organization. And
you know, over the years, when we've handed this out as, to other folks, it's not so much for a single thing that they did, it's more of a body of work. And so it's an honor to be recognized for that. So it's greatly appreciated. And I appreciate Susan Parker and her little elf that gave up the information. I do appreciate you putting it on today's agenda, and I do appreciate sharing it with you. But yeah, I probably would not have. But anyway, I appreciate it. So thank you.
Yeah, congratulations, Scott. Good work.
Thank you.
Are you going to hang it on your wall?
I am going to hang that on my wall, yes.
Okay, so you're going to hang it on your wall, but you weren't going to tell us. Come on. Come on now. Very well deserved. I'm glad to hear it's for a body of work. I was thinking, what, did he build like a sundial bridge in Reading or something like that? And it's like, no, he fills potholes and most recently helped keep our boat ramps open. And so we do appreciate, and we do see, with or without the plaque, how hard your department works and how hard you work.
I appreciate that. Yeah, thank you. Yeah, one of the things that I, you know, in preparing for today, I was thinking about some you know, legacy things that we've done, and you know, when the Valley Fire happened in 2015, it was really kind of the start of the major fires across California, and you know, we developed, and I've got to give credit to Lars Ewing, who put the RFP together, but we put a RFP together for hazard tree removal, and it was one of the first in the state to deal with FEMA and federal funds and you know, the removal of those trees. And that was, for all the next successive fires in the state, that was, I mean, I can't tell you how many counties I gave that RFP to, and it became kind of the base for how other counties dealt with tree removal. So, you know, we here, little old Lake County was kind of the start of how the counties today deal with hazardous trees. So, you know, pretty proud of that. We took our lumps, of course, in learning and making mistakes, and other folks have benefited from that, but pretty proud of that.
Awesome.
Yep.
Yeah, you set the bar, you know, you really did. You know, well, Lake County did, and obviously you're a big part of that, Lars. But that is, and it's coming full circle with the tree mortality and everything. It really is. So, yeah, it's been a pleasure and honor. I'll be one of the first ones. I heard about it from Susan too, and I'm like, man, we got to do something for him. So I imagine everybody else said it too if they heard or had that conversation with Susan. But those accolades as you move through your career and everything are well deserved, Scott. And glad.
Thank you.
Very happy for you.
Thanks.
I'm glad you were surprised, because you told me what you expected out there, and it was to hand out scholarships to students from the local area. That I love it.
Yep. Yeah, it was, the president of our organization got ill at the meeting, and they used that as kind of a little smokescreen to, well, we have to adjust our schedule here, and you know, we were supposed to hand everything out on Friday, and it was during the Thursday morning meeting, and so they used that as a kind of distraction, and then they started doing the Engineer of the Year award, and I thought, well, hold on a second, I have a whole presentation for that, and they called my name, so yeah, it was, again, it was a surprise.
I like those moves.
Yeah.
All right, well, go ahead and open it up to the public briefly, just in case. I'm not seeing anyone online, so I see someone online, they don't see their hand up, so I'll go ahead and bring it back to the board.
Yeah.
And I think Sam, of course, looks like he wants to get a picture.
And Scott, just
Oh, thank you.
thank you for everything.
All right.
I'm staying here, okay.
We're standing here, we're not getting around Scott?
I want to get Susan, okay.
over.
Susan, you got
Yeah, Susan, you did it.
No, but you.
Yeah, you go down there by,
Yeah, you should
right
go
there.
right next to him.
Oh, this is much better. Oh, yay.
He'll get you.
Oh, great. Oh, wait, I want to take a couple of these. Nice. Oh, yay.
Haven't heard that for a while.
What? Oh, yeah.
Oh, do you need?
All right, Scott.
Thank you.
Thank you, and congratulations on that.
Yep.
All right, we've covered everything on the agenda, so we'll move on to closed session. In closed session, we have item 8.1, public employee evaluation, county administrative officer. I'll read off 8.2, but we're going to push that to December 6th. It's public employee evaluation, health services director. Again, that'll be pushed to December 6th. 8.3, conference with legal counsel, existing litigation pursuant to Government Code Section 5456.9D1, Flesh versus County of Lake. 8.4, conference with legal counsel, existing litigation pursuant to Government Code 54956.9D1, Sabaloney versus County of Lake. 8.5, conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9D1, City of Clear Lake versus testate and intestate successors of Bailey Lumbers Company et al. With that, we'll go into closed session. Thank you.